Good.
This is where the music gets dubbed in.
Yeah.
Unless you'd like to sing,
Oh, yeah, right.
just say it.
Doing years ago, in order for us to take the referrals, parent has to take the first step and call us directly. When all the situations happen with the care managers that found
Her voice was very musical.
better knowledge about the services clear, then
Mary looks so serious. Oh, my goodness.
She's trying to listen to one meeting while tuning into another. So that takes the kind of concentration that makes you look serious.
I have never managed to make that work.
I try all the time.
And you have one headset and one, through the speaker, and no matter what, you lose both. So,
Yeah, exactly.
but- okay, I think we'll get started. Good
during
morning,
the
everybody,
pandemic, I believe the challenges for us have been
and
families
welcome to
definitely
Manhattan DD Council.
collect data, because for us, collecting data is very
And
based on the
hopefully,
incidents and analyze the situation to better understand. But
Matt, I'm going to mute you,
I get it.
Mary.
Yeah,
It's
mute
on.
everybody and then we're good.
It's on cue.
Okay, everybody. Welcome to Manhattan DD Council and our last meeting of 2021. I honestly do not know where this year went. 2020 seemed to drag by, 2021 flew by. But, it's good to at least gather together again and catch up on some of the news going on. And hopefully look forward to a better 2022. So we will start with announcements. If you are making an announcement, please also feel free to put the information in the chat. And we will then have that saved as well. So if we want to do announcements, if you use the hand raise, and actually we're small enough group today that, just let's start with hand raising for announcements. If that doesn't work, we'll just unmute. Carolyn?
Hi, yes. Hello, everybody. I'm Caroline from YAI. We have some programs to announce. Our Independent Living Skills program is still taking new people. We also have openings in some of our other programs, including our holiday respite program, our pre-evaluation program through the DOHMH. Our day hab is currently still has some openings, among others, and I'll put the full list in the chat.
Great, thank you. Ellie? You're on mute, you're muted, Ellie.
Okay, NYC Fair is hosting Kerry Neifeld, Acting Commissioner, OPWDD, on January 6th at 6 p.m. on Zoom. Everyone is welcome, although it is focused for families and people with disabilities. So all questions are welcome. I'm going to put the link to register in the chat. You will not get the log-on information unless you register. So do it. Carrie has been doing a road show, going from place to place, and let's see what she says to us. We're gonna not have her read her script, although she says she doesn't have a script. Anyway, please register. It should be good, and it should. It's open to all, and it's a good thing. She's very accessible. Thank you.
Thanks, Ellie. Jen?
No,
Good
fine.
morning, everyone. Good morning, everyone. My name is Jin Jang, and I'm an outreach coordinator from General Human Outreach. GHO has ongoing openings for Day Have Without Wall, community-based pre-vocational and employment programs. And also we have a short wait list for site-based Day Have. And GHO's family support services can assist loved ones with IDB to apply for PWDB eligibility, obtain public benefit entitlements, and CCO enrollment. We have bilingual staffs in Korean, Mandarin, and Cantonese for all programs. And I'll put our contact information on the chat.
Thank you. Jay Kleinman?
Yeah, hi, Jay Kleinman here. Can you hear me? Am I
Yep.
good?
We're
Okay,
good.
great. All right, so we have, LifeSpire has in-home behavior management and parent training. So I'll put the information in the chat. Actually, I said in-home, but by and large, I would say 99% of the families do not want in-home right now. So it's actually mostly remote, so we do it remotely. Okay, and I'll put all the information in the chat. Thanks.
Thanks, Jay.
Yeah.
Lydia? You're muted, Lydia.
Hi, I'm Lydia Dolch from Open the Lid, and we have community classes that are web-based. So now that things are shutting down, it's the perfect opportunity to jump on board. They're covered through community classes funding through self-direction. And it's an incredible group of people we meet daily, 5 days a week for group classes, and folks can sign up for individual classes as well. And we have some open mics and dance parties coming up for people to join in who want to just check it out. So I will leave the information in the chat, and all are welcome. It's super fun.
Great, thank you. Mei Wang?
Good morning. My name is Terry. I'm work at Adopt Community Network. I work as a director of Doorways to Independence program, which is a home modification program. We do have openings for services for all boroughs. And we also have openings for family reimbursement and housing assistance services. I will put the information in the chat. Thank you.
Thank you. Thank you, Terry. Any other announcements? Okay, then we'll move on to government updates. Gavin, city update?
Hi. Yeah, I wanted to definitely give up some updates today related to COVID, as that is on people's minds. So I wanted to start out with just the vaccine mandate. The city has imposed a vaccine mandate on staff that will begin starting December 27th. All employees at private sector businesses must have received at least one dose of the COVID-19 vaccine. And this requirement will not be limited to businesses in certain industries based on company size. But further details, I believe were at least supposed to be announced on the 15th. I haven't followed this completely, but I just wanted to bring it up as it is a city mandate. And there's, with some of these, there's core challenges, there's periods of time when things are on hold. So that is just sort of like the bare bones guidance on that. I also wanted to go into some information about Omicron. I know a lot of people are very concerned about Omicron right now, and rightly so. Currently, Omicron variant of the virus that causes COVID-19 is spreading in New York City. And while we don't necessarily share what the percentages of Omicron in New York versus Delta, I think there's some information on our website regarding this, if you look at the variant tab. But we do know that at this point, there is evidence that, it does spread potentially more easily than the Delta version, but that doesn't necessarily say anything about whether it will be more, cause more serious side effects or symptoms. And so as a result of this, we strongly encourage everyone to, including those who are vaccinated and previously vaccinated, to wear masks in all indoor public settings. So the Commissioner of Health released an advisory, which I'll include in the chat for people if they would like to read it. And it's basically just saying that, Omicron is spreading. And one of the, I think, relevant guidance points in this is that if you can wear a better mask, a quote unquote better mask, needing a KN95, a KF94, those masks have filtration capacity up to 94-95%. So they're potentially more effective than some of the cloth masks or single ply masks. So because this virus does spread more easily, that's something to consider if you can or are interested in wearing it. And that's in the guidance there. In terms of vaccines, so I wanted to go into currently what's available for people and the details on that. Currently, the COVID vaccine is available to all New Yorkers 5 ages and older. Booster shots are available to individuals 18 and older, and these shots boost your immunity basically from an initial vaccination. And we recommend a booster for any adult who received the second dose of Pfizer or Moderna at least 6 months ago, or one of the Johnson & Johnson doses at least 2 months ago. And the booster can be any of the 3 authorized or approved vaccines. So you don't have to feel like, oh, I can't get an appointment for Pfizer, I had that. You can get Moderna and vice versa. And so I think this is gonna make things a little bit easier for getting the vaccine, getting people access to it faster. And so that guidance I think will be useful. And if you were not sure of which booster to get, you can always talk to a physician and talk to them about it. But the official guidance is, well, we recommend getting the same one. It's basically because of the fact that you've had it before, but you do not have to have the same one. And that's sort of the official guidance. In terms of case rates for COVID-19, I always go over this each meeting. Case rates are dramatically rising right now due to Omicron. The current test positivity is around 6.22%, which is increasing. And in the past, we've had levels of 1-2%. That's one measure of how we look at case transmission. And this is for the daily average. And in terms of actual case numbers here in New York City, we are having about 9,471 total cases of COVID as a reference per day, as an average, basically. And all this is on our website. I'll include the links to it. But it is important to take extra precautions now just because of that. And it is circulating more quickly. Cases are increasing, hospitalizations and deaths are increasing, but those do not seem to be, from what I've seen, it doesn't seem to be, sort of the level of the cases, which is good. It seems to be more on the case side. But those are lagging numbers. As you know, our main focus is on vaccine operations, and we have increased our vaccination rate since our last meeting. The number of adults who are fully vaccinated in New York City is now 82.5 and 90.7 for a first dose, which is great. And we are continuing to meet with our state partners to try and think about, coordination with respect to regulations. And the COVID-19 vaccine that I just wanted to mention for kids, there is one available if your ages 5 to 11. This vaccine is really a smaller dose for people who've asked, and it contains a 10 microgram dose, which is 1/3 of the dose in 12 and older. And at this point, people have asked about boosters. As I said, anyone is eligible to get the booster as long as you've met some of the time requirements with respect to the waiting period between your last shot and the booster. We are still doing in-home vaccinations, as far as I know. I can include in the chat some of the information about that. There's a phone number to call as well for transportation. Anyone 12 or older is eligible for that service, and it doesn't need to be limited to an individual who has a disability at this point. But obviously, everyone is going to be welcome to use it. The goal is essentially to increase as many people as possible to get the vaccine. And on our website, we have a vaccine finder. So if you haven't, been able to find it, you can find it there. But also there are many New York City health sites where you can walk in and just get the booster there by waiting in line. So these are the New York City ones. I can't speak to other types of vaccine sites, but certainly those New York City sites have tried to make this as easy as possible through walk-ins and things like that. Let's see. I guess another change since we last spoke is that now, I think I said earlier, 18 or older for boosters, it has been authorized and lowered to 16. And so that's another change. And I think those are my main updates. We also have a commissioner's advisory on, sort of what to do during the season of the holiday season, which I'll include in the chat. This is just a PDF he issued, kind of saying, because this is Friday, like these are the things that people should consider doing to minimize risk. And if you have time, it's worth, taking a look at that. At this point, let's see here. COVID-19, see if I'm missing. I think those are pretty much my updates. I'll include as well a link to the website that will have some information too about, even things as much as variants. And our information may or may not be lagging. I know the CDC, it's about 73% of cases are Omicron nationwide, but then, our website is still saying Delta is the majority. So I think that, that'll be something that will change, obviously, fairly quickly as more cases come in. And I think that's it for COVID, but I did see a couple of questions in the chat, it looks like.
Jay, you had a question, Jay?
Yeah, I did. Thanks. So Gavin, there's some confusion, I'm hearing on the messaging, not necessarily from the city, but I guess, from science in general. So they're saying that that we are safer if we're double vaxxed and boosted against Omicron, but many people aren't eligible for the booster, either because it's less than 6 months since they're sick, or they're a child. And my understanding is that I think children are not yet eligible to be boosted. So are they safer against Omicron, the people in these situations, or are they not safer? Because it's frustrating when you hear you have to get the booster to be safer against Omicron, but many people can't get the booster yet. So What's, do you have any clarification on that?
Yeah, so I think that the booster, as you said, the recommendation is 6 months. Your other, this is a reference. I think other places sometimes just 3 months, but I think here it is 6. As far as I know, unless they changed something really quickly recently. But the issue is, the reason is because the vaccine initially, at least with respect to Delta, was extremely effective at 2 doses if you had an mRNA series, extremely effective. And so there was no reason to consider boosting. Things may change with Omicron because some people are saying, well, is it less effective with 2 doses versus 3, which wasn't necessarily the case. If you'd had a recent series, before the booster. So I think that that's a really good question, and I don't know the answer to it fully. But it depends we do know that the vaccine wanes after time. So like if you had the vaccine a month ago, you probably have very good antibodies, assuming you got the Pfizer and the Moderna. And so the idea of not having the booster at that point and waiting the months is that, you essentially have effective protection. But I hear what you're saying. And I think that whether or not there'll be a change in policy and they'll say, let's shorten the period of time or whatnot.
And I'm thinking like of like for instance, a 13-year-old who may have been boosted 7 months ago, or I'm sorry, who may have gotten a second shot, several months ago. He's not going to be eligible for a booster until he's 16 right now.
Right, exactly. Because you need to be 16. And that's also a recent change because before it was 18 for boosters. So I suspect that the number will be lowered. The question is from a policy standpoint, when they'll do that. I don't know the answer to that, but I hear what you're saying. Yeah.
Will it be lowered before a lot more people get Omicron that maybe wouldn't need to, they're able to get boosters? Okay.
Right. Yeah. That's a good point. And there is also another sort of way to get the vaccine. It's a 3rd dose program, and this is for people with weakened or immune system problems. This is actually a full dose. It's not a half dose, and that can be as soon as 28 days after your 2nd dose. So those people who fit into this category should also take advantage of that if they can, because essentially they'll be able to get the 3rd dose on a more rapid schedule, assuming their doctor says it's fine and everything. And that's been in place for a long time, since several months that policy has been in place. But they will give you can, if you go in under that sort of rubric and that qualification as immunocompromised, whether you're from cancer or whatever, then you can get the 3rd dose sooner between the doses.
Right.
Any other questions for Gavin? Thank you, Gavin. We'll move on to state updates. Samoit?
Good morning, everybody. Can everybody see me and hear me?
Yes.
All right, perfect. So I have some updates regarding the latest state news. So as you guys know, on November 4th of this year, CMS issued an emergency regulation entitled the CMS Omnibus COVID-19 Healthcare Staff Vaccination Interim Final Rule, which essentially mandates staff that are working in locations such as ICFs, developmental centers, specialty hospitals, and Article 16 clinics to be vaccinated. Subsequent to that, I know that there was a legal challenge and the federal courts set aside the vaccination requirement. Recently, that decision was vacated. We received notice, I believe it was yesterday, that decision was vacated, but we have not received any additional guidance from CMS. So at this time, all we're doing is generally encouraging staff as much as possible to get vaccinated, especially if they work in ICFs, developmental centers, specialty hospitals, or Article 16 clinics. And this includes staff that are also co-located in the same building, if not necessarily working in an ICF or Article 16. If they're co-located, this applies as well. The next update is regarding housing strategies for the waiver amendment. So in the summer of 2021, in response to, in the summer of 2022, in response to input collected as part of the 507 plan process, OPWDD anticipates submitting a new waiver amendment application that will focus on expanding choice in residential supports. The amendment will reform the current residential reimbursement methodology to pay for residential habilitation providers based upon acuity of the people served. This change that will ensure that providers are funded to serve people with complex needs. The amendment will also broaden the range of residential supports by promoting greater use of alternatives to 24/7 supervised IRAs, such as supportive IRAs or family care. There's also going to be a redesigning of the supportive residential habilitation rates to allow people with a wider range of needs to live in a more independent setting. That's the latest update regarding that. Another update that I have for you is regarding the initiatives that are available as part of the Appendix K revision. So on November 16 of this year, CMS approved the Appendix K revision to the Office for People with Developmental Disabilities Home and Community-Based Services waiver. Similarly, the OPWDD Disaster State Plan Amendment, it's been revised and is anticipated it will receive federal approval. Both the Appendix K revision and the Disaster SPA, the State Plan Amendment revision, will delineate the workforce stabilization initiatives. This is especially crafted to address the critical direct support professional and family care staffing shortages that came about as a result of the COVID-19 public health emergency. So essentially, there is going to be a form that providers have to sign, an attestation. The provider, so long as they sign that attestation, they may be entitled to receive workforce stabilization supplemental payments. And there are potentially 4 categories as part of the Workforce Stabilization Initiative. That's a COVID service payment, the vaccination incentive payment, longevity. Longevity payment and retention payment. So the COVID service payments are for, let's say, a provider who wishes to participate in the COVID service workforce stabilization initiative. They must acknowledge and attest that they will adhere to the requirements as set forth in the attestation, and that they must complete and return a survey in the form, format, and timeframes specified by OPWDD so that we can determine the amounts each provider may be eligible to receive. So the providers, the provider must distribute payments of a minimum of $1,000 consistently and equally to each direct support professional and family care provider that was employed full-time in that capacity for at least 90 days during the period of the first agency payroll that occurred on or after March 17, 2020, through the first agency payroll that occurred on or after September 1st, 2021. And the person is employed by the provider agency on the date the provider agency distributes the COVID service payments. So the employee must still be employed by the provider in order to receive these payments. Just keep in mind. There's also a vaccination incentive payment. So any provider wishing to participate must also acknowledge and attest that they will adhere to the requirements prior to receiving any vaccination incentive supplemental payments. The provider must distribute the payments if they once received The provider must distribute payments of a minimum of $500 consistently and equally to each direct support professional and family care provider that was employed full-time and has completed the COVID-19 vaccination regimen as of the first complete agency payroll that ends on or after January 14, 2022. And the employee is still employed by the provider agency on the date the provider agency distributes the vaccination incentive payments. Providers must also distribute payments of a minimum of $250 to each DSP and family care provider that was employed at least but not fewer than 20 hours per week and has completed the vaccination regimen. There's also longevity payments. So any provider wishing to participate in the Longevity Workforce Stabilization Initiative must acknowledge and attest that they will adhere to the requirements. So providers must distribute payments to each direct support professional and family care provider that was employed at some point during the period from April 1st of 2020 through March 31st of 2021. And the employee must have continued to be employed by the provider agency through the first complete payroll that ended on or after September 1st of 2021. So that takes care of the longevity payment. And then there's the retention payments. So a provider wishing to participate in the Retention Workforce Stabilization Initiative, they again must acknowledge and attest that they will adhere to the requirements associated with it. The providers must distribute the providers must distribute payments to each direct support professional and family care provider that is employed at some point during the period of April 1st, 2021 through March 31st of 2022. And the employee continues to be employed by the provider agency through the first complete payroll that ended on or prior March 31st, 2022. So the payments must be in the form of a one-time salary increase. Enhancements to or payments for fringe benefits are not an acceptable use of supplemental payments made to the providers. I referenced a number of times an attestation form. The attestation form is available online. The completed attestation for any provider that wishes to take advantage of these initiatives must be submitted to OPWDD no later than January 9th of 2022 in order to qualify for any of the workforce stabilization initiatives. These attestations can be submitted electronically to covid@opwdd.ny.gov. And that concludes the state updates, OPWDD updates.
Thanks, Sam. And I know a couple of questions have come up in the chat, but also just to let people know, OPWDD did do a webinar on these FMAP changes. The webinar was held yesterday, and thank you, Lynn Decker, for posting the link to the YouTube video. And I'm sure there'll be further information posted on OPWDD's website on that.
Yes.
A couple of
Thank
questions.
you, Kathy, for that clarification.
Not a problem. Ellie?
Yeah, I'm going to ask it again but I know the answer. Just can't you please share what you're reading with us? It's already been approved. We know that. It's very difficult to follow because it's a very dense, important recap.
Yep. So these are notes that I personally took from these are notes that I personally took from the technical assistance call that we had yesterday regarding the initiative. And these are just notes that I personally take. They haven't been vetted. These are just, like I said, personal notes. What I suggest you do, I know when James, who is the deputy director for Manhattan, when he presents, he has talking points, but these are just my personal notes.
Okay, but he doesn't share them either. So
I will certainly address that with him. He's not currently on this call, but I'll make sure to address it with him. And thank you, Kathy. You indicated that the recording of the technical assistance is available online.
Already? Yes. No, it's not available yet. No, Lynn is saying no.
The YouTube that I posted is the one from about 2 weeks ago.
Okay.
Yesterday.
Oh, okay, I know yesterday's session was recorded. When I
Yes.
find the link, which I know it will be published shortly if it hasn't been already, I'll send it to Kathy. Can I send it to you and then you can share with the group?
Absolutely. Please share it. I did attend the webinar yesterday, so I will probably also get the link or the email once it's posted and available.
Okay.
So once that's done, we'll post that on the council website.
Okay, thank you.
Yeah, not to beat a dead horse, but please try to convey how frustrating it is.
I will.
Thank
I
you.
certainly will. Thank you.
Jackie, did you have your hand up?
Hi, I just wanted to ask a question. In terms of the funds that are going for workforce stabilization, are there any funds allotted to the agencies who are going to need more time, effort, and manpower to get these stabilization payments to their workforce? Is that at all considered in the increase?
It's one of the things that are currently being considered, but we haven't received any definitive guidance yet. Right now, the most pressing issue has been in terms of the DSP shortages and family care provider shortages. So this is basically an initiative to really address that critical gap in service. I know a lot of providers, and not just in New York City, but statewide have shared concerns about that. I don't know why my camera's not working. Can you guys see me now?
Yes.
Okay, sorry about that. So that is the main focus, but I know that they are looking at other options as well. But for now, that is the most critical need that's been identified, and we're working on addressing through these initiatives.
Sam, there was also a question in the chat, and not sure if you know, but do you know approximately what percentage of people supported or supported through family care?
I don't know, but I can certainly look it up and get back to you.
Okay, thanks. And then also a question on the state plan or the waiver amendment on the residential rate changes. Is there an estimated time on when that will be posted, or will that be open for comments prior to?
Anytime we make an amendment or submit for an amendment, there is a period of time where it is available for comment. I don't have a specific date as of yet, unfortunately.
And I'll ask it anyway, because I'm sure many people are thinking it. Will this be based, will the acuity factors be based on the CAS?
I know that that's something that we are moving towards. I don't know if I shouldn't say I don't know if we're quite there yet, but I know that we're moving towards that. And once we know additional information, we'll certainly share with the relevant parties, including the DD councils as well.
Thank you. Any other questions for Sam on state OPWDD updates? Thanks, Sam.
Thank you, everybody. Happy holidays. I'll still be on the call, but I just wanted to wish everybody a happy holidays.
Thanks, Sam. Happy holidays. Winnie, IAC update?
Hi, everybody. So I might as well start with the federal situation with the Build Back Better funding, the HCBS increase, and of course that is to continue the increase for the longevity and retention payments that Sam was just talking a lot about. So there was a hope that it would happen before Christmas. Then there was an admission that it won't happen until after the new year. And now, of course, there is trouble with the Build Back Better agenda because every single Senate vote counts. And there is one objector who is an extremely powerful person in Washington, D.C. So as of the most recent update from our national anchor, they said that the HCBS funding was not in question or in danger, but of course, anything is possible. What that federal money will do if it remains intact the way we see it right now is give us a continuing 6% increase on the enhanced FMAP, which would at least go a long way toward, helping us to make that increase permanent, the enhanced FMAP funding permanent. So we're not going to be doing anything with alerts until after the new year. Congress is not in session right now. The Senate is back on the 3rd and the House is back after that. So stand by, and then we'll give a whole big push again to try to preserve the HCBS funding in the Build Back Better plan. For state stuff, Dick Gottfried, who is a good attender of our breakfasts, is not seeking re-election. So if he comes to this breakfast coming up, that would be his maybe his last time with us. So he's the chair of the Assembly Health Committee, and he's been a great supporter, as many of you know. Another thing that happened is Tish James decided not to run for governor, and that is actually a good thing, because it appears like Kathy Hochul is a good supporter for our services and industry, and has many good connections with Donnie in Western New York. So we are rooting for her. Also, Tish James has been a great attorney general, and also Shelley Mayer, who was running for the AG, has also stepped down when Tish James said that she was stepping down from the governor's race. So Shelley is the chair of our education committee in the Senate, and she has also been really supportive there. So all good, except for the loss of Dick, but who knows? We'll see what happens with the health committee. For the legislative session, the State of the State is going to happen on January 5th, and Kathy Hochul is going to present that in the Assembly Chamber, which is the way it happened prior to Governor Cuomo. And it is a real signal that she is interested in working closely with the legislature to consider their interests and opinions. And that's also really good for us, because we have very good friends in the legislature. So it's, the old days are new again, and it seems like all a good thing. The first day of actual session is January 10th, and the governor will make her budget presentation by the 18th of January. So on the 10th, there's going to be a rally in Albany. Right now it's in person. We'll have to see how things go with Omicron, but that is for employment of people with disabilities, and the employment subcommittee in the Assembly is working hard with us on a package of bills to enhance opportunities for employment for people with all kinds of disabilities. But lucky for us, the focus has been on IDD, and I think it will be broadened over the course of the session, but currently we're kind of taking center stage there, and I'm looking forward to that rally on the 10th, and a notice will be coming out on that pretty soon. Any of you are welcome, although it's a long trip in January for just something that's happening at 12:30 and then you go home. On the other hand, there's also going to be a rally, although we're planning limited attendance, and once again, it might go virtual on the 11th, and that is a NIDA wrap-up rally for our initiatives for our pre-budget initiatives, and this is a statewide thing. NIDA is all 7 associations that represent providers of services to people with IDD, and first of all, we're looking at the COLA, which is a 5.4% increase this year, and also that continuing the 20% increase for DSP staff, and including 100 and 300 code staff, which would be cleaners and cooks and clinical staff, who are also in short supply at the current salary levels, and we want increases for them as well. So almost all the bills have been delivered to the governor's desk at this point. They had until, I always figured that it was until December 31st. That was the way we used to talk about it, but we have recent information now that it's actually that bills have to be delivered prior to the next session. So technically, the legislature is never shut down. They're never out of session. They're always at the call of the speaker or the call of the temporary president of the Senate. And that is so that they can quickly get back into session if they need to for any reason, instead of going through all of the procedural things that need to happen when you shut down session and then reopen it. However, That first day of session, which is going to be January 5th in the state of the state in the Assembly Chamber, is the official end of last session, or maybe it's the 4th. So all bills have to be delivered by then. Or there's this thing called a pocket veto that could happen. So if any bills are left over, then they can quietly die 30 days from that date. However, our most important bills have both been delivered, the only two that are left, and that we're really watching closely. Although there's a couple of others that we're also interested in, but we'll report on what happens with them when they are signed or vetoed. But these two are the tuition parity bill for our 4410 and 53 schools, and the early intervention covered lives legislation that would require insurance companies to pay their fair share for early intervention costs. So those two bills have been delivered, and that indicates that there has been a decision made by the governor's office already. Nevertheless, we have between now and the time that we know the bill is either signed or vetoed to make a big deal. So for the education bill, we resurrected our letter writing campaign. We're doing social media. And actually, I haven't tweeted yet today, but I'll be tweeting out another education link or a set of links for and tagging the governor and some other elected officials in Albany. And the more people that participate in that, the better. They really need to hear from us. You know, we're calling it a Twitter storm, and we do want it to be a storm. Plus, get your letters in. And those letters can be, it's just one click, really simple, and you can do it every 24 hours. And they don't look to see like, hey, wait a minute, Kathy sent a letter yesterday, and now I have another one from her today. That's not right. They don't look at who they're coming from. It's a volume thing. So please help us. And we're going to be doing the same thing for early intervention, although we have good reason to believe that that bill is going to be vetoed. It made it much farther this session than it's ever made it before. So that is a win in itself, but we're not sure we're going to be able to do anything about early intervention. The education bill is anything can happen, and we've heard threatening things and heartening things, and I'm not sure where we're at right now. So every single letter and call and tweet and everything will really help us there. In addition, as far as advocacy goes, BJ Stasio, who is currently president at the Self-Advocacy Association in New York State, has an initiative called Rise Up Together. And he is looking for 10,000 letters to hand deliver to the governor in a meeting that he will have with her. I don't think the meeting's been set yet, but they're working on it. And so I'm doing Rise Up Monday, and every single Monday, again, same deal. They're not looking at who the letters are from. It's a volume thing. We want him to have an impressive stack. So Rise Up Monday, I will send it out next Monday again, and we'll look forward to getting more of your letters. OPWDD revised their training deadline for AMAP and SKIP-R because it was really, really hard to get staff certified during COVID. And of course it still is. And maybe now COVID is certainly an issue, but the staffing crisis is a bigger issue. And we can't afford to have staff go to training and get recertified, even though these are vitally important trainings and we get that. We did a little survey of our providers, and we got 41 responses. And it's, you know, even with the very best efforts, we're only going to be able to get half the staff who need to be certified by the deadline, which is December 31st. So we presented the data yesterday to OPWDD. They were surprised and hadn't realized that this would be an issue, and they're going to look at extending the deadline. So we'll keep you updated on that. And what I wanted to ask you guys, and I plan to also ask the IAC members, is what's the infection rate been like in your day programs and residences? Is it exploding all over the place and lots of people have COVID right now? A lot of quarantining and all that?
Yeah, we went from having nothing for, I think it was 13 months in a row, to having from 0 to 15 in the last 6 days.
Okay. It sounds like New York State has been breaking records for the past 4 days. for positivity. And that's really a bad sign. So that fits what Jim just said. Anyone else?
Jim, can I ask a question? Are these people with symptoms or just because you're getting them tested, or how's that happen?
Half and half and half. It started with symptoms and spread from that to others who, some got symptoms, but others did not.
Okay. All right, thank you for that. That's my report from IAC.
Thanks, Winnie. Committee reports. Andrew, I know you have to leave shortly, so do you want to do transition committee update?
Sure. So my name is Andrew Harris. I co-chair the Manhattan Transition Committee along with David Summers from AHRC. We just had our December meeting last week covering the range of residential supports and programs within OPWDD's system. We had a nice panel, including a representative from the DDRO covering the referral process, as well as two representatives from AHRC who spoke both about certified residential options and also housing subsidy and customized supports. Really great meeting. Our next meeting is going to be our 2022 version of the online adult service provider meet and greet. That's going to be an opportunity to learn about various programs available through various organizations. So if you're one of those organizations, we'll reach out right after the new year with more details about how you can participate. And then Jackie, Mary, just give me a thumbs up if I'm presenting for you guys, if you're covering it.
Sorry, I'll cover it, Andrew. Sorry about that. I was using sign language.
Yeah, go ahead, Jackie. You want to?
So
at least put
yeah.
advisory.
I, along with Mary McGuire-Weafer, co-chairs of the Manhattan Family Support Services Advisory Council, which you think I'd be able to say more fluidly after this amount of time. A couple of announcements. We are having our first 2022 workshop on educational advocacy. That's going to be a Zoom on January 13th from 10 to 12 with Kate Hoy from AHRC. I anticipate that one of the things that's going to be talked about is graduating 21-year-olds, some that had an extra year this year, some that were graduating anyway, and what that process is going to be like. The other thing is that as everybody knows, Margaret Puddington, the wonderful Margaret Puddington, is stepping down from the state representative. And so we are taking nominations. If anybody wants to nominate themselves or wants to nominate somebody else, the council is taking nominations and we will be voting on it at the January 13th meeting. And finally, I wanted to say that very proudly, the Transition Committee and my committee will be representing the Manhattan DD Council at the Include NYC Fair, which is a virtual fair this year on January 29th from 9 a.m. to 1 p.m. There's going to be all kinds of programs, after school, camp, support services, and you'll be able to speak to representatives one-on-one or in a group. That's it. Happy and healthy New Year.
Yes, Margaret?
Yes. I'd like to report on a couple of things from the Statewide Family Support Services Committee. So as Jackie mentioned, I stepped down from my roles there and a new chairperson has been elected. His name is Chris Palega. He's from Finger Lakes, the Finger Lakes region. So I'm no longer the chair. I'm still the Manhattan rep until we have a replacement. And as Jackie said, that process is going to be started. But I wanted to also tell you a few things that happened at the last couple of statewide meetings. As a lot of you may know, OPW had been exploring a redesign of the family reimbursement program. What they initially set out to do was combine all kinds of reimbursement into one, so that providers would not specialize in, say, transportation reimbursement or emergency respite reimbursement or anything like that, or camp reimbursement. All of it was supposed to be combined into one reimbursement type and with a $1,200 cap. So the members of the statewide committee were not happy with this at all. There were a lot of other things that also were proposed that we weren't happy with. And we worked among ourselves, and we also reached out to our local support services advisory councils and got input. And so we got a few wins. Emergency reimbursement is now set apart. It's not part of the $1,200 cap. And ADM is going to be coming out at some point with all of this, delineated. So emergency respite won't have a cap, but what it does have, and we couldn't do anything about it, is a lifetime limit of one reimbursement per lifetime of a certain type. In other words, if you got emergency respite reimbursement, you could only get that once. Never mind if you have one parent who just died and the other parent has cancer. You can only get it once. And they said you have to look around for other resources if you have needs. If you have bed bugs once, you can only get reimbursed for that once. If you have a leak, a plumbing leak that damages the child's room or something, only one time can you get that. But we couldn't budge them on this. We argued that since family reimbursement is a fund of last resort, in the first place, before applying, people would have already looked for other resources, and there aren't any. So what they did say is, if you have a situation that's really an extreme emergency, you can go to the DDRO, and on a case-by-case basis, maybe they will consider it. So there's that. And then we also wanted camp to be split off. But it isn't going to be. Camp is going to be part of that $1,200 reimbursement. And then we also wanted respite reimbursement to be split off. And the reason for that is upstate New York, the situation with respite is very different. Some areas don't have respite providers at all, or else they have only minimal services that are available for just a few people. It's very bare bones. And we felt that in cases like that, families should have separate access to reimbursement for respite so that they can at least have some. That's the only vehicle that they have upstate for getting respite. So we did get that, but we got a $3,000 cap per year for that. But at least it's split off. So that was those were the main things. There were many other things. We're still not happy at all, but it's better than it was. Families are supposed to go to only one provider for respite, and all providers are supposed to offer all types of reimbursement. You can't specialize anymore. In the event of an extreme situation, a very unusual, unique situation, you could go to the DDRO to apply to get reimbursement from more than one agency, but still the agencies are all going to have to offer the same type of reimbursement. So I don't know when this ADM is going to be released. They're working on it. But we don't get another chance to comment. That's it. But we did do a lot of work and we did make it somewhat better, but we're still very unhappy with this. Also at the last meeting, we had a presentation on something that's it's a misnomer. It was called gap analysis. And normally if you think of a gap, it means something that doesn't exist, a lack of services, for example, but that's not what this was. This was an analysis that was requested by Ted Kastner, previous commissioner, to study the differences between waiver family support services, which they don't call family support services anymore, and contract family support services that is funded with straight state dollars. And so there are many advantages that family support contract funded programs have that the waiver ones don't. First of all, you don't have to get waiver, which is a big, long time, eligibility process. And the criteria and the design of the programs in the family support services are in general more flexible than the ones in waiver. So that was what was discovered, and that was there were charts there were narratives, there were all kinds of things, but it was very interesting. And OPW was very interested in that, although I think some people think that there was other type of a gap analysis that was presented. I'm not sure they all kind of listened carefully. So we'll see what happens with that. So I just wanted to let you know that that's what's going on in the Statewide Committee.
Ellie, you had a question?
Oh, I have 1,000 questions, Margaret, but what, because all of this was started with Dr. Ted there, and you now have Kerry Neifeld, is there any chance to revisit the whole point of it? The ADM, the new, yeah.
I don't think so. She was at the meeting.
Right.
She was at this last meeting. She heard
Yeah, no,
some
I
of it.
listened to most
She
of it.
heard
but-
some of it. She didn't hear all of it. She was late
Right.
coming into the meeting.
Right.
Um,
Have you guys as a group maybe gone and said, I'm trying to clean my mouth up, but
I know what you're saying. Yeah.
yeah, no, seriously, because it was not her initiative. The gap analysis at any rate, I mean, that holds, that's a thing. But all of the push to limit, I mean, the whole idea of the definition of an emergency is that you don't know that it's going to happen. So how can you be limited to one, thing?
One reimbursement per type.
Right.
Yeah.
I mean, I lost, 3 teeth this year. Did I not,
I got the sense that if you push hard enough, you can go to the DDRO and you can get an exception, but it has to be really warranted. The gap analysis was a Ted Kastner initiative, but the cleaning up of family reimbursement that's an effort that's been ongoing for I don't know how many years, at least 3 or 4.
right,
There
but
was
the conclusions feel very Kastner-esque.
They were all justified. Everything, everything that we wanted, they justified. They said this is the $1,200 is an average spending that they conducted throughout the state and all that kind of stuff. And I don't think that there's any hope because they're so tightly justified. They're repeating the same justifications. So it's.
But yeah, but the
she would-
justification
if
seems
we
to be.
go- if we raised it, she would really have to override some of her top staff. So I don't think there's a good odds for that.
Yeah, I was just thinking in terms of the justification is only in financial terms and not in family health and safety. Just if you think of anything or if anybody thinks of anything, let's just, attack it from, just from more people as opposed to.
And along those lines, Margaret, do you know if the ADM will be released as a draft first, open for comment
No.
from providers?
Nope.
I could be wrong. But according to what Sam said, that ADMs have to have a draft comment. But this was a very strange thing because the draft was never released. We never got to see it. We had a working committee of 5 and the statewide committee. They got to see it, but the rest of us never got to see it. So technically, it wasn't released to the public. It was only released to a subset of the public.
Correct.
So I don't know. You're raising an interesting point there.
Yeah, and I did attend the past couple of
Yeah.
statewide meetings, and I have to say, your council absolutely advocated and did everything they possibly could to push back on this, and thank you for that. But providers are the ones that are going to have to implement.
Yes. Yes.
And to, you know, come out with an ADM and a new process and, you know, I think the term that they used last week was operationalize.
Yeah,
that providers will have
85 times.
to operationalize this new way of doing it. Some of this is, you know, for the amount that providers get, may not work. This just, you know, yeah, I would hope that if this is going to be released as an ADM, that it would be released as a draft first, open for comment from all stakeholders, not just the limited amount.
Yeah, I can inquire about that. But what they did do was they submitted it to, I don't remember the exact name of it, of the committee. Jim or Winnie, you might know, the Regulations Committee, the
Regulatory reform.
Yeah. Well, I don't know if it's regulatory reform or regulations review, or I don't know. But they did. I mean, I know Richard Bosch was on that panel. So they released it to a select group of providers and a select group of families. And I think they think they're done.
Well, maybe the word select is what's wrong with the whole thing. It affects too many people to, you know.
Yeah, well, as we pointed out to them, we discussed it among all of the 19 members of the statewide committee, and they were all invited to take it back to their local councils. So that's quite a bit of input that we got from families, but not from providers. There's a whole tracking system and everything that they want to put into effect, that they will put into effect, to make sure nobody spends more than the little $1,200.
And to make submitted weekly.
And to make sure that they don't go to more than one provider. And we pointed out that if you're only allowed to go to one provider, the provider knows how much they're spending. You got to trust them to not spend more than the $1,200 per person. Seems like it's really overkill. People wondered if something had happened, if perhaps there had been malfeasance of some sort among some providers, but I don't know. Or this was just, the dream that they came up with.
Most other family support services have been waiverized for years. Along with the gap analysis, I know years ago when they were looking at respite and including that under the waiver and the liability, there was an analysis done at that point, and it costs more. It costs the state more to waiverize it because you're then paying for, well, at the time it was MSC, now it's care coordination at even a higher rate. And so it costs more, but things change.
But we got double the amount of services. I mean, I remember when Tom Moore was announcing how many more respites and recreation programs and overnight respites everybody was going to get district by district. And it was pretty impressive.
Yeah. Carolyn?
Sorry. Oh yeah, I had a question. Margaret, did you get the sense that they're trying to push people towards self-direction with these new caps and things?
Not really. I mean, from what we hear, they want to limit the growth in self-direction.
Okay.
But I don't know. I don't know.
Yeah.
I mean, and they were saying, if you have self-direction, this was another one of the justifications. We were saying if you have self-direction, you still could have an emergency and you might not have a budget for that. And they wouldn't give you emergency reimbursement. They refused. They said it's not fair because people with self-direction have IDGS and they have OTPS, And that should do it for them, even though we pointed out that that's, as Ellie said, you can't predict an emergency. That's the nature of an emergency.
Yeah,
And
I
we
was
offered
wondering-
various possible things, possible solutions to address that, but they wouldn't accept them.
Oh, yeah. I was wondering because like with all these, I'm like, well, like you could get technically more money from self-direction. So I was like, maybe this is a way they're trying to push people, like a soft push towards it. But, and then the other thing I was wondering was when they were doing the gap analysis, did they note that people who are undocumented, if we move things to more of a waiver
yeah.
service,
Yeah.
okay, good, yeah.
Yeah. Maybe not specifically, but it was understood.
Okay.
Because of the whole, issue of qualifying eligibility for waiver, and that a lot of people are not going to be. Yeah.
Yeah.
No, I
Okay.
think it was explicitly stated. Yeah.
Okay, good.
Yeah.
I was worried that they might get overlooked because I know that happens sometimes. And I was like,
Yeah,
oh,
no, I think it was in there.
Okay, good.
Yeah.
Thank you.
Thank you again, Margaret.
Sorry we weren't more successful.
Nah, I know it was not for a lack of trying. Okay, moving on to Family and Provider Information Committee. Louisa, are you still on? No, I guess Louisa left. But the upcoming meetings will be posted on the Manhattan DD Council website. So keep an eye on that for upcoming committee meetings. And then finally, the last committee meeting, legislative, Jim or Lynn?
Since it's a gap here, 3 months ago, we thought that we would be able to do this independently again. From 6 weeks ago, we decided not to. It will be held virtually and together as we did last year. Date probably in early March again. We will, I guess, be trying to get the 5 boroughs together here sometime in January to come up with priorities and formats.
Thanks, Jim. Yes, all 5 DD councils will be joined together once again to do the joint legislative event. And details on that will be forthcoming after the new year. Any other new business comments, concerns? Then on that note, please have a happy and safe and healthy holiday and new year, and we will be back in January. Love those reindeer antlers, Ellie. Thank you and have a great day.
Have fun, everybody.
Thank you.